Hi all, does Tylenol use cause autism? That's the new thing right now, right? Tylenol and autism. Tylenol is the generic is acetaminophen or paracetamol, depending on where you are in the world. The question is, does it cause autism? And what side of the political spectrum are you on? This should not be political at all. Does it or does it not? Is it associated? Is it not, right? So this is a big deal right now, and especially in the United States, because RFK Jr. and President Donald Trump came out about a week and a half ago and stated that Tylenol has been linked to autism when used during pregnancy. And it just blew up, right? Oh, they're not scientists. They don't know. They shouldn't be giving medical advice. Now, did Donald Trump go a little far when he said pregnant women should not be using Tylenol? No one should be using Tylenol anymore. Probably. That's overstepping his bounds. As a president, he is not a doctor. He is not someone who can make those recommendations. But to say that they are speaking out of turn because they're not scientists is ridiculous, really, because most people aren't physicians, and they say, well, we don't smoke tobacco because it caused lung cancer, right? Oh, you're not a doctor. You can't tell me that. No, the data is the data, right? Science is science. And whether or not you agree with the political person who said it is a different story, right? So let's not just ignore the information simply because you don't like who said it, or let's not just listen to it because you like who said it. Let me remind you that Bill Gates was a huge figurehead during COVID, right? He was not a scientist. He's never been a scientist. He funds a lot of science, but that doesn't mean that he is a scientist. He just gave recommendations based on the science and information that he was being given. Same thing is happening with RFK Jr. He is a lawyer. I would say he's more qualified than even Bill Gates during the COVID thing, because at least RFK Jr. has been working with pharmaceutical companies and physicians and healthcare for a very long time. So he's now the head of the disease in America. There's a reason for that. So he's not a physician, but he definitely knows enough information to know about the politics and be able to interpret some science, especially using his scientists that he has on hand, right? Which I would say is probably more than what Bill Gates had. So let's not say politics in this at all. Okay, let's take politics out and look at the information we have. So as a pharmacist, I was taught and have been practicing that Tylenol is a very safe medication when used appropriately. It is the highest cause of liver failure in the United States. That's not because it's dangerous per se. That's because people think it's so safe when it's over the counter, they'll take any dose. And that happens with all over-the-counter medications. People think if it's over the counter and I can just buy it at the local pharmacy, that it's perfectly safe and I never have to worry about side effects. And I know the bottle says you cannot take more than 3,000 milligrams a day. It used to be 4, but they dropped it to 3,000 milligrams because of liver failure risk. They found that over 3,000 milligrams increased your risk. 4,000 for sure increased your risk. So over the counter, they said anything under 3,000 milligrams increases your risk of liver disease. We've always known that. But as long as you stay within the recommended dose, you take 2 Tylenol a day because you have arthritis, liver issues should not be a concern unless you already have liver disease. But if you don't, you have a healthy liver, Tylenol should not cause liver disease. That's not to say it cannot, it's just incredibly rare. The people we see liver disease and Tylenol with are people who already have significant liver failure, or take massive doses, or take it in combination products, and they're not even realizing they're getting that much acetaminophen. So you can take Tylenol alone, the acetaminophen alone, because maybe you have a fever, body aches, arthritis, who knows, headache, and then you also have a cold and flu, so you start taking some NyQuil that also has some Tylenol in it. Let's say you have some arthritis and the doctor gave you a prescription for, some medication product that's a combination painkiller, like Vicodin, that's hydrocodone, a codeine derivative, and acetaminophen. You see what I'm saying? After a while, if you're not paying attention, you're not just getting acetaminophen from the one product. You're getting it from 2, 3, 4 different products. All of a sudden, you're in the over 3,000 milligrams a day category, right? So that's a concern with Tylenol just on its own, right? Otherwise, Tylenol is pretty well tolerated. It doesn't have a lot of side effects, and it does work pretty well, especially for fever. I don't think it works great it's not an anti-inflammatory. So if you're taking it for inflammation, it's not really going to do anything. But it is a good medication when it comes to some headaches. Some people respond well, some people don't. Arthritis, it's more of joint pain and just pain, not an inflammatory thing. It works pretty well, and I think it works very well for fever. It works well for fever in kids as well. But now the question is, how safe is it? So we know there's risk of liver issues with Tylenol, acetaminophen, but does it cause autism? And as a pharmacist, I think this is very important because we have been saying that Tylenol is safe as long as you stay within the recommended dose for literally everybody. From birth until death, Tylenol was safe. Pregnancy, Tylenol is safe. And to be fair, I took Tylenol once. I've been pregnant 4 times, and I took Tylenol once because I had a fever of 104 for 3 days. And that's the only safe thing you can take in pregnancy. I couldn't take ibuprofen. So I took Tylenol during one of my pregnancies. My kiddos are fine, no autism. But that does not mean it doesn't cause autism. That means that my kids didn't get autism from the exposure. So now the question is there data showing that Tylenol causes autism? So the newest data that just came out of Harvard, actually. So when people say, RFK Jr. is not a scientist, well, Harvard scientists did this study, and it was an evaluation of the evidence of acetaminophen use and neurodevelopmental disorders. That includes autism and ADHD and just other high rates of childhood mental health diseases, right? And it looked at 46 different studies that were either case reports or cohorts, a case series, where they reported acetaminophen and autism or acetaminophen and ADHD, and they looked to see was there a positive correlation, meaning that when a pregnant woman, and they were all pregnant, so when a pregnant woman was exposed to Tylenol during pregnancy and the baby was exposed, did that baby, after birth, at some point in their life, get diagnosed with one of these neurodevelopmental disorders? And so what they found is out of the 46 studies that ended up being included, because they had to meet certain criteria. They had to be pregnant at one point and report taking or have drug tests for Tylenol, something that showed that, yes, in fact, they took Tylenol during pregnancy. And then they looked at the charts of the children born after. That's how those studies were included. So there were 46 studies they looked at. And 27 of the studies reported a positive association, meaning that exposure to acetaminophen in utero during pregnancy had an association with higher rates of neurodevelopmental disorders. 9 of the studies showed no difference. So there was no link one way or the other. And then 4 of the studies showed a negative association, meaning that exposure to Tylenol actually had a positive effect. There were fewer kiddos who had neurodevelopmental disorders. So like I said, 46 studies, 27 of them showed an association of autism or ADHD when exposed to Tylenol. 9 of them showed no association, and only 4 showed something positive, like it's actually protective against. So what this study concluded was that there's likely, possibly, an association between Tylenol use during pregnancy and neurodevelopmental disorders, because 27 out of 46 of their studies, so more than half of the studies they looked at, showed that negative outcome. That's where this is coming from, which is shocking because as providers, pharmacists, physicians, nurses, we were always taught that it was safe. It's been on the market so long, we don't even study it anymore. So could this possibly be the cause or a cause of autism. And as a pharmacist, I am hearing so many people in my group of pharmacists that I know, because I know a lot, who are just poo-pooing this whole thing, saying this is ridiculous. Tylenol is 100% safe. That's dumb. And if you ever have a pharmacist or physician who looks you dead in the eye and says that Tylenol is 100% safe during pregnancy, do not worry about it, you should never trust them, because it's not the fact that it does cause autism and they're lying to you. That's not it. They're not lying. They are not open to any future possibilities. Does that make sense? A scientist, a provider, a physician, a pharmacist should always be open to the possibility of changing views. Okay? I mean, for instance, in the 1940s and 50s, women smoked during pregnancy, and doctors recommended it because it decreased anxiety about the pregnancy, it relaxed the woman, it had to be good for babies. So doctors recommended it. And if back then doctors did not question it when we started finding out that lung cancer was associated, not caused, associated with cigarette smoking, then that would have been a bad doctor. So if you have a pharmacist who flat out says, or a physician flat out says, absolutely not, I'm 100% certain that Tylenol is safe in pregnancy, you need to rethink who your providers are, because they should always be open to the possibility, especially because the autism rates in this country are astronomical. It's 1 in 36 children have some neurodevelopmental disorder. That is just incredible. And no, it's not because of better diagnosis. Because if we had better diagnosis, then adults would be being diagnosed. 50, 60, 70-year-olds would be diagnosed with autism because obviously they've had it their whole lives. They don't grow out of autism. So if they have it, then we'd have 50, 60, 70-year-olds being diagnosed with autism with the new criteria. But we don't. We have young, like 30 and under people being diagnosed with autism. Okay? So that's my first point. My second point is, I'm not saying that Tylenol causes autism, but I'm not poo-pooing it. I think it is a possibility, but I think my biggest concern right now is it's a red herring. Because most women who take Tylenol in pregnancy also received the Tdap, the tetanus, diphtheria, pertussis vaccine during pregnancy. So the question is, did the women who received acetaminophen during pregnancy also receive the Tdap during pregnancy, and which one is causing the autism? Or is it both, right? Is one pushing the other over the edge? Same thing can be said about kiddos when they're infants and they're getting their vaccines on schedule. And, my normal 12-month-old baby was developing great until vaccines. And I gave acetaminophen the day they got vaccines because my doctor told me that it would help with the arm pain and the fever and just the achiness that comes from vaccines. Well, in the legs, right? I gave them acetaminophen. And then, 2 days later, they were not the same kid anymore. You hear that over and over again with a lot of severe autistic children and their parents. The parents will say they were fine, then they got their vaccines, and they weren't fine. So was it the vaccines that pushed them over the edge? Or was it the acetaminophen they gave with the vaccines that kind of pushed them over the edge? I think that the blame on Tylenol is convenient for pharmaceutical companies because acetaminophen has been generic for so long, they don't make money on that. They make, I imagine compared to, Ozempic and Mounjaro and all of these new drugs that are being used constantly, they're making bank on those drugs. Acetaminophen's they don't make anything with acetaminophen, which means why not blame it? If we can keep the vaccines on the schedule and blame something else that's not vaccines, then we can keep getting reimbursed and paid for all of these vaccines we give. I mean, in one go, a 2-month-old can get 7 or 8 vaccines, 7 or 8 diseases vaccinated against in one go. Tylenol makes them nothing. So if they can blame the Tylenol because we always give Tylenol with the vaccines, I feel like it's a convenient story. I'm not saying that the study that came out of Harvard is something we should just ignore, but I do caution blaming Tylenol fully. I also have to say that I have never heard of a parent say that my child was fine until 15 months old and they got a fever and I gave them Tylenol and 3 days later they were a different kid. I've never heard a parent say that. I've never heard a parent who isolated acetaminophen as the cause that kind of, pushed them over the edge. I have heard it countless times with vaccines, but I've never heard it with simply just Tylenol. So part of me also wonders, is there a compounding effect? So glutathione is a product in your body in your liver that helps remove toxins from your liver, from your body. Heavy metals, especially aluminum, which is found in vaccines. Glutathione removes toxins from your body. And about 40% of the United States population has a glutathione deficiency. There's a gene called MTHFR. It's methyl tetrahydrofolate reductase. And about 40% of Americans actually have this mutation, meaning that they're not creating enough glutathione or it's not working appropriately. So it's not eliminating toxins as well as the other 60% of Americans who don't have this. So let's say you have a pregnant woman who is pregnant with a baby and they both have MTHFR glutathione deficiency. And you give them a medication that inhibits glutathione, that's acetaminophen, and they are exposed to some toxin, whether that's food-related, environmental-related, vaccine-related. They now have this toxin, a high dose of aluminum in their body or a high dose of lead or something that they got from the environment in their body. And their glutathione level is not enough to remove that toxin. Can that possibly affect the development of the child in utero? Absolutely. Now, what happens if you already have a glutathione issue and you add the acetaminophen and whatever glutathione that baby was capable of using now can't be used at all, and they're born with severe, metal toxicities because of exposure in utero, and now they have a neurodevelopmental disorder? Does that make sense? So it's not so much the Tylenol itself, but the mechanism of which the Tylenol could be causing a problem. So basically, they're kind of on the ledge anyway. We give them a toxin, let's say it's Tdap during pregnancy, so they get that pertussis boost before the baby's born. And now they've got those toxins in the body that the baby and mom can't remove because they already have a glutathione issue. And now we gave them Tylenol, which just pushed them over the edge. Now they cannot remove those toxins. Maybe baby's born with that. They just have a glutathione deficiency. They can't remove these toxins. That's what pushes them into these neurodevelopmental disorders. My point is, I don't think that it's only Tylenol that's causing autism. I don't even know if Tylenol is the cause of autism. All I'm saying is look at the science. And so far, the data is showing that there is a possible association. And we should not forget this. There are so many autistic children right now. And yes, some are very highly functional, great, wonderful kids. The other children are great and wonderful, but not functional at all. And these parents have to figure out how to take care of these children for the rest of their lives. What happens when the parents die? And where do their kids go? Do they go with other family members? Do they get put in a home? These are true fears of parents who have autistic children, severely autistic children. And right now we're kind of bunching them all together and saying, but autism is just a personality disorder. Sure, for the ones who were very, very minimally impacted. But if we can find a cause or multiple causes or even a cure that can possibly remove those toxins, get that glutathione back up, why wouldn't we do that? We're not curing their personality. We're curing their disease. Autism is a disease. It's impacting so many lives. And if you can have a child who can't go to kindergarten, you fix the problem or at least prevent it in the future, and now we can get kids to go back to kindergarten. Wouldn't you want that for your child? I would want that for my child. So I want to just get out there that Tylenol could possibly cause it. I think it's a red herring when it comes to toxicity of other things like vaccines, but I'm not ruling it out. If I was truly, truly concerned that Tylenol really caused autism during pregnancy, I wouldn't give it to my kids. I wouldn't give it to me. But I don't think, especially my family, we don't have an MTHFR gene mutation. We're fine. We're probably the population that drives everyone else crazy saying, well, I took it and I'm fine. My kid took it and he's fine. Yeah, because we don't have a gene mutation that makes it possible. But 40% of Americans do. So I would be more concerned about those populations that know they have it. But I also would just caution, make sure you're not using it every day. Especially, I also wonder, are the pregnant women who have these neurodevelopmental disorder children taking obscene amounts of Tylenol during their pregnancy? Like, I took it for 2 or 3 days. I think it was 2 days when I had a fever. I had a reason to take it. I took it every 6 hours for a few days, and then I was done. But maybe some women take it every day for headaches. They take it every day for back pain. I don't know, right? So maybe the higher the exposure, the higher the risk. But again, that would still mean that there is a risk associated with acetaminophen. So I just want to inform you that there is information, there is data, there's science looking at it. There's 46 studies that looked at it, and 27 of them showed some concern. Now, the other pushback I often get is, association doesn't equal causation. Correlation doesn't equal causation. Sure. But at some point, you have to look into it enough to realize it does cause it, like lung cancer and cigarettes. It was associated with lung cancer. It was correlated with lung cancer. The more you smoked, the higher your risk of lung cancer. Yeah, but some people get lung cancer and don't smoke. Right. At some point, you have to make the switch from correlation or association to causation simply from the plethora of evidence. And as long as we keep looking into it, and as long as we are open to it, I think that's always the best way to go. The other thing I want to mention is I have a book as a pharmacist that is dosing of acetaminophen and ibuprofen products that are over the counter for children. So, if they have a fever or they had some procedure done, they had some dental work, who knows? They've got some reason they need a pain or fever medication. I have a book that doses it very specifically. So if you are 22 pounds, this is your dose. If you are 42 pounds, this is your dose. If you're 15 pounds, this is your dose. That way we're not overdosing it. I like to be able to decide what dose my child gets instead of just the standard 5 milliliters of ibuprofen. Maybe they're supposed to be 5.6 or 4.5 or maybe even 3. And it says, anywhere from 3 to 5 milliliters. And I just want to give them 3, but the bottle told me 5. Well, I can give 3. So my dosing guide gives you a range based on your kid's exact weight. So you can decide, I actually want a lower dose. So I recommend that with the Tylenol and the ibuprofen, so you're not overdoing it for a kiddo. I also use dosing syringes instead of the dosing cup, because when I pour 5 milliliters in a dosing cup and I pull it up in a syringe, it's like 7 milliliters. So it's hard to gauge in a little dosing cup, but you can pull it up in the syringe. So, Brittany, do you want to remove the acetaminophen from your book? Not yet, because I still feel comfortable using it. The data is still pending. This study does make me a little more weary of it. I am paying attention because I don't want to do anything that's going to harm children. Now, these studies were done in pregnant women exposed to acetaminophen, not children exposed to acetaminophen. I'm not convinced that acetaminophen is the main cause. I think it's a red herring, but I'm not eliminating it as a possibility. But because of that, I still feel comfortable giving my children acetaminophen. But I would have a risk benefit discussion with patients. So if you have a pharmacist or physician who's like, take your Tylenol, it's totally safe, don't worry about it, you should get rid of that person, that provider. But I think it's worth having a risk benefit. If your provider says, I think it's safe. I haven't seen any issues with my patients. I don't think that's the main concern, but there is this information that it could be associated with it. That's a good physician. That's someone who will have a discussion with you, risk benefit, and decide what do you think is appropriate for your family, right? So I'm going to leave it in my book because I still think it is a useful medicine when necessary. For instance, like my kids get fevers of 104 and they start throwing up every 15 minutes until that fever's down. They will throw up for hours unless that fever comes down. So when I give ibuprofen, it works great. But about 3 or 4 hours later, they're throwing up again because the fever's going up. But I can't give the ibuprofen again for a total of 6 hours from the first dose. And they're throwing up at like hour 4 here. So sometimes I'll do an alternate ibuprofen Tylenol. I like ibuprofen better. It works better. But I will throw in some Tylenol if I need to stop them from throwing up every 15 minutes for hours. So I do think it still has its place in therapy, but I want you to know that you're not crazy. If you think that your child is impacted by acetaminophen or a friend or a family member, I think it's valid because the data says so, right? But if you also feel like, risk benefit, you need the acetaminophen because I don't know what, maybe you threw out your back when you're pregnant and you can't get out of bed, right? I'm not worried that 1 exposure or 2 exposures to acetaminophen is going to cause autism in your kid. Could it possibly? Maybe. But I'm not super worried about it. So what I'm saying is I'm going to keep it in my book, especially because I don't want you overdosing your kiddos on acetaminophen. At least keep it in my book so we know a good low to moderate dose that we can give the kiddos if we're going to use it. And just understand that science changes all the time, right? We learn new information and we should be willing to change with that information. And we are right now desperately looking for answers, especially parents of autistic children. They're looking for answers. Why is my child like this? How do I prevent it? And is there a way to fix it? So that's my take on the acetaminophen autism controversy. Hopefully you can have good discussions with your family and friends about it. Feel a little bit more confident in why we know what we know right now and why we're being told that Tylenol and pregnancy may be more concerning than we ever thought before. Information changes. Please also remember that regardless who the politician is, look at the science, look at the data, look at the studies that they're quoting, because you may trust a politician and do something that was not a good idea. Or you may need acetaminophen for one reason or another, and you trust them so much, you hate them so much, like RFK Jr. and Donald Trump, you hate them so much that you'll take like any dose. I've seen people overdosing on acetaminophen during pregnancy to prove a point. What kind of maniacal person would do that during pregnancy? Simply because of politics. Don't let politics run your health. You're in charge of your health. Look into it. We are in an age where you can literally look up anything online. I didn't even have to go into a medical website, PubMed, to look up the Harvard study. I just Googled it and it pulled it right up. So we're in an information age. Do your own research and talk to your doctors and tell them, if you find a doctor that's not willing to budge on even the possibility of a medication not being the most amazing drug ever, then you should just get a different physician. All right, I hope this was super informational and helpful for all of you. If you ever have questions, just put them in the comments below and I'm happy to answer anything. Thanks so much. Bye.